Head and neck cancer and its treatment impacts various aspects of a patient's life. This can range from an impact on eating, on appearance, on breathing, on interacting with the outside world, employability, and even peace of mind. Attention to nutrition, to emotional health, to dental health, strength building and swallowing allows us to treat these cancers better and allows the patient to get back to normalcy better. That is the aim of our Prehab and Re-Hab program, and we have a short film here to tell you about this program that is in operation at the Apollo Proton Cancer Center.
Head and neck cancers affect speech and swallowing and other functions because of the critical structures related to these cancers like tongue and other various organs involved in speech and swallowing. Treatment of these head and neck cancer can cause further impairment in speech and swallowing and form and function. So various problems what we see after this treatment, this type of treatment are difficulty in speech, difficulty in communication, dysgeusia, that is difference in taste, then shoulder dysfunction, then dryness of the mouth, then the shoulder deformity. So these are few functional problems we see following head and neck cancer treatment. Prehabilitation. Prehabilitation is defined as a model of exercises given before a definitive invasive surgical or non-surgical treatment to improve recovery and early enhanced recovery following this invasive treatment. Rehabilitation is a continuous process which continues throughout the treatment and following treatment, whereas prehabilitation is usually started a few weeks before the treatment starts, so that during the treatment and after the treatment we have the best possible recovery and outcomes.
Mental health comorbidities in cancer are seen in 50% of those people diagnosed with a medical disease. 10% of those have a syndromal diagnosis. We are able to pick up only 23% to 25% there, and we miss 75% to 78% of mental health comorbidities in cancer, which could include depression, anxiety, OCD, psychosis, substance use disorders, and the whole spectrum of mental health comorbidities as described in ICD and DSM. Predominantly, the main reason for this low level of detection is significant stigma in both conditions, both common mental disorders as they are called and the medical diagnosis of cancer itself. Failure to detect these abnormalities will result in decreasing quality of life, decreased adherence to treatment, significant caregiver distress, and increasing interpersonal difficulties between carers and patients with a medical disease and the treating team. It is very important that the quality of life of a person diagnosed with a medical disease of cancer be maintained till the very end.
The concept of dental rehabilitation is to render the patient as dentally healthy as practically possible before the treatment, ensure the same status is maintained throughout the treatment, and rehabilitation afterwards. It includes a comprehensive dental and oral assessment regarding the extraction of non-salvageable teeth, retention of those teeth which are viable, which can be restored, and then preventive treatments like oral hygiene instructions to retain a plaque-free mouth, and topical fluoride application to combat with radiation caries and other dental issues. And then fabrication of maxillofacial prostheses like splints, obturators, mouth guards, and guiding flanges before the surgery. Whereas dental rehabilitation restores the oral functions and cosmesis in head and neck cancer patients so as to provide a decent quality of life. It also aims at replacing missing teeth and associated structures with dental implants and maxillofacial prosthesis, and protection of the remaining dentition by fluoride therapy and crowns and bridges.
80% of head and neck cancer patients go through a condition called as dysphagia or swallowing problem. So they come as a presentation of the tumor or during or post their treatment. So for all these patients, a detailed assessment of the condition is prerequisite before the treatment. So when we are presented with a patient, we assess for the condition basis their symptoms and signs. Most of the patients, a clinical examination is warranted at the first visit of the patient. In the clinical assessment, we generally look into all the muscles and structures involved into swallowing. And if there is a presentation of dysphagia or swallowing difficulty, we go through all the prerequisites required for them. Mostly it is a clinical examination which will involve the muscles, the structures, the functioning of these muscles in very depth, and the counseling is warranted at the first sitting. Basis the symptoms, basis the observations, we will be giving them custom-made exercises for the patient so that their journey through the cancer treatment is much easier.
The primary goal of physiotherapy is to mitigate physical side effects, prevent future impairments, and enhance the overall quality of life. This can be achieved through targeted exercises and educational guidance for the overall well-being of a patient. The key approaches include management of pain such as jaw pain, neck tension, and headaches will be managed by the transcutaneous electrical nervous stimulation, which is otherwise called as TENS, in helping the patients to relieve out of this pain. And shoulder dysfunction and nervous issues addressed by the combination of strengthening exercises of the shoulder, retraining of the shoulder, posture correction, and reducing the tightness of the chest wall. Therabite and other therapeutic exercises are combined. Therapeutic devices such as Therabite is used in conjunction with therapeutic exercises to reduce the trismus, which is otherwise known as jaw dysfunction. Additionally, ultrasound therapy will be administered for these patients to enhance the temporomandibular joint function, enhance the joint functionality.
I'm Shubha, Senior Clinical Dietitian at Apollo Proton Cancer Center. Today I'm going to talk about the prehabilitation and rehabilitation nutrition in head and neck cancer patients. They have a lot of challenges during the treatment, even after the treatment. So during the treatment, they used to have dry mouth, swallowing difficulties, loss of appetite, taste alterations. Taste alterations, it's mainly related to the side effects radiations. Nutritional assessment is very much essential after the diagnosis, so that we'll get to know the nutritional status of the patients and deficiency and risk of malnutrition. For head and neck cancer patients required high protein, high calorie nutrition and adequate vitamin and minerals. Proper hydration also important. Rehabilitation nutrition focuses on recovery. Continued nutritional support is very important. Then diet consistency also needs to be taken care. Oral nutrition supplement, who can't able to take adequate nutrition, oral nutrition will help them. Enteral nutrition, if the intake is inadequate, enteral nutrition will help.
Just to put in a few concluding remarks on what our rehabilitation specialists have dwelt on at length. Here at APCC, we lay great emphasis on both the prehabilitation and rehabilitation of the patient. This is because our care starts much before we give the definitive treatment, which we call as prehabilitation, and it goes far beyond the overall treatment, which is rehabilitation. This not only strengthens the patient physically, but also psychologically. This empowers them to live the best life with an excellent quality.